Good morning, LKN. It is 8:34, and we are joined by Grace Perez, fertility specialist from Reach Fertility on the phone. Grace, thank you so much for joining us this morning.
Hi, yeah, thanks for having me.
Yeah, so glad you were able to join us. So we are talking with Reach Fertility, who does fertility for women and families who are looking to have children. And a special thing too, September is a special awareness month. Is that correct?
That's correct, yeah. It's PCOS Awareness Month this month.
So what is PCOS if people don't know about that?
Yeah, PCOS is actually one of the most common things we see patients for here at Reach. And it's just one of the most common fertility disorders in general. Basically, it's a hormonal condition that affects your ovulation and can cause irregular periods, but it can also cause like abnormal hair growth on your face or your body, or it can cause acne, can cause weight gain or difficulty losing weight. So it's something that we manage pretty frequently here.
So how do you find out if somebody has PCOS, and then what's the treatment plan for that?
Yeah, it's sometimes a little tricky to diagnose because there's not just a single test for it. It's a combination of your symptoms, blood work, sometimes an ultrasound that you end up with a diagnosis. But we usually do all the tests that we can to make sure that we're pinning the right diagnosis. And then there are a lot of different treatments available for PCOS patients. We don't just do IVF here at Reach. We also have medications we can give to help manage weight or to help you ovulate. So there's kind of a whole array of treatments depending on how severe the PCOS is for the patient.
And then when we're talking about PCOS, right, you think of that like that's a symptom that's causing all these issues and all these problems. But how does that relate with fertility? What effect does PCOS have on fertility for women?
Yeah, the primary thing, is that it can make it very challenging or hard for you to ovulate on your own. And ovulation is when the egg becomes available to get together with the sperm and make a baby. So that's usually our biggest battle is just getting those eggs available for pregnancy.
So once you find out that a woman does have PCOS, kind of what's the protocol for you then moving forward with them when they're talking about starting a family?
Yeah, we at Reach like to do an individualized approach for all of our patients. And so the plan can look different for each patient, but I like to get a really detailed history physical workup done. And then we can come up with a plan individualized to what the patient's family goals are.
Okay. What does that usually look like? Let's say that I come in and I'm trying to start a family, I'm having difficulty. I say that we find out and I'm like, finally, I know what's wrong. And then What do I do? Like, what are we doing next? So you say you come up with that individual family plan, but what would an example of that look like?
Yeah. So I would say a lot of our patients, if they haven't done any kind of treatment at all for PCOS, and if they're having irregular periods, so we assume that they're not ovulating on their own, a lot of times I'm giving them a medication like either Clomid or Letrozole. It's just a pill that you take for 5 days at the beginning of your cycle. And then we're monitoring what it does to your eggs with ultrasound and blood work, and seeing if we can help time ovulation to increase your chances of pregnancy for that month.
So you guys really become a partner in building that family with them. Kind of you don't just say, okay, this is what's going on with you. Take these pills and go home.
No, absolutely. We like to keep a close eye and see how they're responding so that, if they don't respond the way we like the first month, we can make adjustments for the next month and just kind of continue to increase their chances month by month until we help them get pregnant.
I'm imagining that this road of fertility and infertility treatments and whatever way it comes, you really do become part of their family, right? You're helping them create a family, but I'm sure you become part of their family. Do you have any stories that you'd want to share?
Yeah, absolutely. We have a lot of patients that we become very close with, and I've had some patients in the past couple of years who I've worked with, sometimes for months, but sometimes if the case is really tricky, for years until they get their baby. Some of my favorite memories are when my patients bring their babies in to meet me afterwards, which just makes this job even more rewarding. But yes, to answer your question, we become very close with our patients and sometimes become attached and sad whenever, they have to leave us when they get pregnant because they go back to their OBGYNs at that point.
Right. And do you work with, let's say that I know a lot of people you work with, they want to have their first child. Do you see a lot of people who have infertility after after they've had their first child, maybe no issues getting pregnant first, but then issues getting pregnant again?
Yes. Yeah. What you're describing is what we call secondary infertility, which is exactly what you just described, where, no issues with the first baby, but the second baby, they're surprised to find that they're having a little bit harder time. Unfortunately, that is pretty common, but we kind of treat them similarly to we would if they, presented never having a baby. We do like a full workup and try and get some answers for them.
Yeah. So no different treatment plan for them than you would if someone was trying to have their first child.
It just kind of depends. I would say if you've had a baby before, it's definitely reassuring, a good sign. You've been pregnant before. I think we can do this again in most cases. But yeah, a lot of times it's just starting from the drawing board and getting all the data and the answers we can. And sometimes the treatment looks similarly to if you had never had a baby before.
Yeah. And then as a fertility specialist, outside of treating PCOS, which September is PCOS Awareness Month, so we're glad that we were able to talk about it and bring a spotlight to it. But what else do you do as a fertility specialist?
Yeah, so PCOS is definitely one of the most common conditions that we see. But we also see a lot of patients with other infertility diseases. Another common one is endometriosis, which is characterized by really painful periods or pain with intercourse. And then some of our patients just don't ovulate, but don't necessarily have a diagnosis that we can come up with. We just, they don't ovulate or they're not ovulating regularly, so we have to help them out with that. Some of our patients, it's more on the male partner's side that there's something going on with the sperm, that we have to give the sperm a little bit of help. Some patients, they've in the past had a lot of babies, but then they got their tubes tied, and later they realize, I actually do want another baby, and so we kind of have to help them navigate how are we going to help you get pregnant after that surgery. So there's a lot of different shapes and sizes that infertility can look like, and some of our patients have a diagnosis of unexplained infertility, which means we did all the tests and we can't really put our finger on exactly what's going on, but we still have a lot of treatment options available for those patients as well.
You said you guys don't just do IVF, because I think that's when somebody goes to a fertility specialist, they assume like that's my only route.
Well, and I thought that's all they did.
Right. Katie Stankiewicz is here with me co-hosting. She thought that's all that you guys did. So, educate us on some of the other things that you may, you mentioned the testing and things, but other routes to get pregnant outside of just IVF.
Yeah. I'm glad you asked, because I think a lot of people are hesitant to come to a fertility clinic because they think that IVF is going to be forced upon them or immediately the first thing that we do. And that's certainly not the case, especially if you've never done any kind of fertility treatment before with your OBGYN. But what I described earlier with the PCOS patients is something called ovulation induction, where we would sometimes give you medications to help you ovulate. And that's kind of the lowest invasiveness. We just give you pills. Sometimes we're giving you a shot to help you ovulate once per cycle. And then we're helping you time when to have intercourse based on, when we believe that you'd be ovulating. And sometimes we do that in conjunction with what's called an IUI, or intrauterine insemination. And this I do a lot for my patients who, their partner's sperm doesn't look 100%. So what we do is we take their sperm and we kind of wash it down to the best swimmers, put them in a vial, and we deposit the sperm through a catheter through the cervix into the uterus, just to kind of help the sperm along during ovulation. So those are kind of the two lower aggressive treatments. So a lot of patients are trying those rounds or multiple rounds of each of those to hopefully get success before we move forward with IVF.
Yeah, so lots of different options. What's the best way for someone to reach out to you if they're looking to make an appointment?
Yeah, so you do not need a referral to be a patient at Reach. And our website is reachfertility.com. You'll be able to find our contact information there. So you can either request an appointment through the website, or you can give us a call, and we'd be happy to get you set up.
All right. Thank you so much for joining us. Reach Fertility. It is PCOS Awareness Month. Thank you so much, Grace, for joining us. Reach out to Reach if you're looking to start and grow your family.
Yeah, thanks for having me, guys. Have a great weekend.
Absolutely. You too. We'll be right back with Jason Drum Landscape Supply.